So sticking with the scheduler and sort of scheduler adjacent, but if any of you out there are administrative users, you'll have previously probably or at least maybe seen appointment save restrictions. If you haven't, it's up here under admin config and appointment save restrictions. Restrictions are just a way to tell the system that based on certain criteria to block an appointment from being saved in the system. What we've done now is actually allow for those appointment save restrictions to also flow to, or sorry, apply to scheduler events that are created. And you can actually turn it on if you go into the options form, anybody with administrative privileges, and you just search for restriction. And you'll see here under scheduling admin, there's the respect appointment save restrictions for scheduler events. And what this will ensure happens is if we have an appointment save restriction, when we go to save a scheduler event, it's going to look at those appointment save restrictions and apply them when we're creating the event. So I'll just walk you through that. So this particular staff that I'm logged in as has a credential of MD. So we'll use that as an example. So I can choose appointment save restrictions by credential. I'll choose MD. And so you can see here, I have a Fidelis as a disallowed insurer. You could do different diagnoses. This will show you all of the services listed in service input. But let's say in this example, my provider here isn't credentialed with Fidelis, so we don't want him to be able to record appointments for Fidelis as an insurer. Okay, so if I go into the scheduler and we'll just try to create an appointment, we'll pick my patient here. You can see the primary payer for this test patient is Fidelis. So if I go to save, you'll see I'll get this pop up, right? So it says, obviously, the payer Fidelis has been disallowed for the credential level of MD here. Right? So that's what we just looked at in the appointment save restrictions. So anyone in the system with a credential of MD, if they try to record, whether it's an event on the scheduler or an appointment in patient contacts with that new setting enabled, they're going to be from actually saving it and creating it. So that would need to be changed. Okay, so you can do the same thing by insurer. So if I come back to admin config, appointment save restrictions, and then by insurer. So let's choose Blue Cross Blue Shield. Right. And so for this particular payer, let's say they don't actually reimburse us for this CEAP service. Right. So we can disallow that whenever there's a match between Blue Cross Blue Shield on the event or in the patient contact. We want the system to block us from doing that. Okay, so if I go back into the scheduler, pick another patient. So you can see this particular patient has Blue Cross Blue Shield, and let's say we're going to collect or select the UHC service. When I go to save, you can see we have the appointment save restriction that gets popped up, right? So and it tells us exactly what happened. The combination of Blue Cross Blue Shield and this EAP has been disallowed, and now it's asking us to select a different primary service. Right? So it's something that we've had multiple organizations ask us for in recent times. So it's sort of a priority to get it built out, and hopefully it'll help prevent, because it'll allow you to, if you use the workflow of creating a scheduled event and then automatically creating the linked appointment, it should prevent appointments being created where specific information or specific combinations of information are disallowed. So that's the new change, and hopefully it'll be one that's helpful and one that's pretty straightforward to use for everyone.